1. What is the primary pathophysiological process in asthma? A. Airway obstruction due to inflammation and mucus production. B. Airway destruction and loss of elasticity. C. Bronchial dilation and airflow restriction. D. Inflammation of the alveolar sacs. Answer. A. Airway obstruction due to inflammation and mucus production. Rationale. Asthma involves chronic inflammation of the airways, leading to bronchoconstriction, mucus production, and airway hyperresponsiveness. 2. Which of the following is a common trigger for asthma exacerbations? A. High altitudes. B. Stress. C. Cold air. D. Alcohol. Answer. C. Cold air. Rationale. Cold air is a known asthma trigger as it can cause bronchoconstriction and irritate the airways. 3. Which diagnostic test is primarily used to assess lung function in asthma? A. Chest X-ray. B. Spirometry. C. Arterial blood gas. D. Sputum culture. Answer. B. Spirometry. Rationale. Spirometry measures lung function, assessing airflow limitations, and is key in diagnosing and managing asthma. 4. Which of the following medications is classified as a quick relief, rescue, medication for asthma? A. Fluticasone. B. Salmeterol. C. Albuterol. D. Montelukast. Answer. C. Albuterol. Rationale. Albuterol is a short-acting beta agonist, SABA, used as a quick relief medication to relieve acute asthma symptoms by dilating the airways. 5. A 15-year-old patient presents with increased wheezing and coughing, especially at night. The patient's peak flow is measured at 60% of their personal best. What is the most appropriate action for the nurse to take? A. Administer a short-acting beta agonist and monitor for improvement. B. Order a chest X-ray to rule out pneumonia. C. Continue to monitor the patient without intervention. D. Recommend the patient perform a breathing exercise. Answer. A. Administer a short-acting beta agonist and monitor for improvement. Rationale. A peak flow of 60% indicates a moderate asthma exacerbation that requires a quick relief medication like albuterol. 6. A patient with asthma reports frequent nighttime symptoms and difficulty breathing. Which of the following medications should the nurse expect to be prescribed for long-term control of asthma? A. Albuterol. B. Theophylline. C. Prednisone. D. Fluticasone. Answer. D. Fluticasone. Rationale. Fluticasone is an inhaled corticosteroid that helps control chronic inflammation and reduce the frequency of symptoms, including nighttime asthma symptoms. 7. Which of the following is the most common symptom of an asthma attack? A. Cyanosis. B. Wheezing. C. Hemoptysis. D. Chest pain. Answer. B. Wheezing. Rationale. Wheezing is the hallmark symptom of asthma caused by airway obstruction during an asthma attack. 8. Which of the following is a primary function of inhaled corticosteroids in asthma management? A. Dilate airways. B. Decrease airway inflammation. C. Relax bronchial smooth muscle. D. Increase mucus production. Answer. B. Decrease airway inflammation. Rationale. Inhaled corticosteroids reduce inflammation in the airways, helping to control asthma symptoms and prevent exacerbations. 9. What is the most appropriate method for teaching a patient to use a metered-dose inhaler, MDI? A. Inhale rapidly and hold the breath for 10 seconds. B. Inhale deeply and exhale immediately. C. Shake the inhaler before use and exhale slowly before inhaling. D. Use the inhaler after meals for better absorption. Answer. C. Shake the inhaler before use and exhale slowly before inhaling. Rationale. Shaking the inhaler ensures proper medication dispersion, and exhaling before inhaling ensures a better intake of medication into the lungs. 10. A patient with asthma is using a peak flow meter to monitor lung function. What is an indicator of a significant asthma exacerbation? A. Peak flow greater than 80% of personal best. B. Peak flow between 50 to 80% of personal best. C. Peak flow greater than 100% of personal best. D. Peak flow less than 50% of personal best. Answer: D. Peak flow less than 50% of personal best. Rationale: a peak flow less than 50% of the personal best indicates a severe asthma exacerbation, requiring immediate action. 11. What is the mechanism of action of beta-agonist bronchodilators in asthma? A. Increase airway inflammation. B. Stimulate beta-2 receptors to relax bronchial smooth muscle. C. Decrease mucus production. D. Increase the production of leukotrienes. Answer: B. Stimulate beta-2 receptors to relax bronchial smooth muscle. Rationale: beta-agonist bronchodilators stimulate beta-2 receptors, leading to the relaxation of bronchial smooth muscle and bronchodilation, helping to open the airways. 12. What is a common side effect of systemic corticosteroid therapy in asthma management? A. Weight loss. B. Increased blood pressure. C. Drowsiness. D. Increased appetite and weight gain. Answer: D. Increased appetite and weight gain. Rationale: systemic corticosteroids can cause side effects like increased appetite and weight gain, along with other effects like fluid retention and hyperglycemia. 13. Which of the following is a non-pharmacological intervention for managing asthma? A. Regular exercise to improve lung function. B. Smoking to clear the lungs. C. Avoiding all medications. D. Drinking caffeinated beverages. Answer: A. Regular exercise to improve lung function. Rationale: regular exercise helps improve lung function and overall physical fitness, which can help in managing asthma symptoms. 14. What is a common cause of nocturnal asthma symptoms? A. Poor sleep hygiene. B. The body's natural circadian rhythm. C. Increased indoor allergens like dust mites. D. Excessive physical activity before bedtime. Answer: C. Increased indoor allergens like dust mites. Rationale: indoor allergens such as dust mites, mold, and pet dander can exacerbate asthma symptoms, especially at night when environmental triggers are more concentrated. 15. In asthma, what does the term airway remodeling refer to? A. Reversal of airway inflammation over time. B. Permanent changes in airway structure due to chronic inflammation. C. Complete closure of the airways. D. Hyperresponsiveness of the airways to allergens. Answer: B. Permanent changes in airway structure due to chronic inflammation. Rationale: airway remodeling refers to permanent structural changes in the airways caused by chronic inflammation, which can lead to reduced lung function over time. 16. A patient with asthma asks how to avoid triggers. Which of the following should the nurse include in the teaching plan? A. Avoid all physical activity. B. Use air purifiers to reduce allergens. C. Eat foods that are high in dairy. D. Sleep with windows open. Answer: B. Use air purifiers to reduce allergens. Rationale: air purifiers can help remove allergens like dust and pollen, reducing the likelihood of asthma triggers. 17. What is the primary role of leukotriene modifiers in asthma treatment? A. Increase inflammation to clear airways. B. Prevent bronchoconstriction by blocking leukotriene receptors. C. Open airways by relaxing smooth muscle. D. Treat acute asthma attacks. Answer: B. Prevent bronchoconstriction by blocking leukotriene receptors. Rationale: leukotriene modifiers block the effects of leukotrienes, chemicals involved in inflammation and bronchoconstriction, helping to prevent asthma symptoms. 18. A patient with asthma is prescribed a long-acting beta-agonist, LABA. When should the nurse educate the patient to use this medication? A. During an acute asthma attack for immediate relief. B. Only before exercise to prevent exercise-induced symptoms. C. On a regular schedule to help prevent asthma symptoms. D. Only when feeling short of breath at night. Answer: C. On a regular schedule to help prevent asthma symptoms. Rationale: LABAs are used on a regular basis as maintenance therapy to help prevent asthma symptoms from occurring. They should not be used as rescue medication. 19. What is the recommended action when a patient with asthma experiences wheezing, coughing, and shortness of breath despite using their rescue inhaler? A. Call for emergency medical assistance. B. Use the inhaler again and wait for symptoms to subside. C. Drink a glass of water and rest. D. Take a hot shower to relieve symptoms. Answer. A. Call for emergency medical assistance. Rationale. If symptoms persist after using a rescue inhaler, it indicates that the asthma attack is not controlled and emergency medical assistance is needed. 20. What is a common characteristic of exercise-induced asthma? A. Symptoms are worse in the morning. B. Symptoms occur after exertion, particularly in cold, dry air. C. Symptoms are relieved by rest and oral hydration. D. Symptoms are only triggered during sleep. Answer. B. Symptoms occur after exertion, particularly in cold, dry air. Rationale. Exercise-induced asthma symptoms typically appear after physical exertion, particularly in cold, dry air, and are often relieved with rest. 21. What is the most appropriate response when a patient with asthma reports taking their short-acting beta agonist more than twice a week? A. Encourage the patient to continue using the inhaler as needed. B. Reassess the patient's asthma management plan to ensure better control. C. Instruct the patient to stop using the inhaler and contact the provider. D. Recommend the use of oral steroids immediately. Answer. B. Reassess the patient's asthma management plan to ensure better control. Rationale. Frequent use of a short-acting beta agonist indicates poor asthma control, and the patient's management plan should be reassessed for better control. 22. Which of the following is a characteristic finding in a patient experiencing an asthma exacerbation? A. Clear lung sounds with no wheezing. B. Increased respiratory rate and difficulty speaking in full sentences. C. Decreased respiratory rate with shallow breathing. D. Bilateral crackles heard upon auscultation. Answer. B. Increased respiratory rate and difficulty speaking in full sentences. Rationale. During an asthma exacerbation, the patient often has an increased respiratory rate and difficulty speaking in full sentences due to the severity of airway obstruction. 23. Which type of asthma medication is used to provide quick relief during an acute asthma attack? A. Long-acting beta agonist. B. Inhaled corticosteroids. C. Short-acting beta agonist. D. Leukotriene modifier. Answer. C. Short-acting beta agonist. Rationale. Short-acting beta agonists, such as albuterol, are used to quickly relieve symptoms during an acute asthma attack by rapidly dilating the airways. 24. A patient with asthma is experiencing persistent cough and shortness of breath. What is the first step in managing this patient's condition? A. Administer a short-acting beta agonist and assess response. B. Prescribe oral corticosteroids for immediate relief. C. Recommend rest and hydration. D. Provide an antitussive medication for the cough. Answer. A. Administer a short-acting beta agonist and assess response. Rationale. The first step in managing an asthma exacerbation is to administer a quick relief medication, like albuterol, and assess the patient's response. 25. What is the goal of long-term asthma management? A. Eliminate all asthma symptoms. B. Reduce the frequency and severity of asthma exacerbations. C. Increase the use of short-acting beta agonists. D. Treat acute exacerbations as they occur. Answer. B. Reduce the frequency and severity of asthma exacerbations. Rationale. The goal of long-term asthma management is to reduce the frequency and severity of exacerbations by controlling inflammation and preventing triggers. 26. Which of the following should a nurse include in patient education regarding peak flow monitoring? A. Use the peak flow meter only when symptoms are severe. B. Peak flow readings should be taken only in the morning. C. Record the personal best peak flow and use it as a baseline. D. Peak flow measurements are unnecessary if symptoms are not present. Answer. C. Record the personal best peak flow and use it as a baseline. Rationale. Peak flow monitoring helps track asthma control, and the personal best peak flow should be recorded to use as a baseline for comparison. 27. What is a common side effect of long-term use of inhaled corticosteroids? A. Oral thrush. B. High blood pressure. C. Sleep disturbances. D. Weight loss. Answer: A. Oral thrush. Rationale: oral thrush is a common side effect of inhaled corticosteroids due to local immune suppression in the mouth. 28. Which of the following symptoms indicates that a patient's asthma is well controlled? A. Using the rescue inhaler multiple times a day. B. Experiencing symptoms during physical activity. C. Having no symptoms or exacerbations between doctor visits. D. Having to adjust medications frequently. Answer: C. Having no symptoms or exacerbations between doctor visits. Rationale: well-controlled asthma is indicated by the absence of symptoms and exacerbations, allowing the patient to manage their condition without frequent medication adjustments. 29. What is the role of a spacer device with a metered-dose inhaler, MDI? A. To increase the dose of medication. B. To help coordinate the timing of inhalation. C. To prevent medication from entering the throat. D. To decrease the amount of medication used. Answer: B. To help coordinate the timing of inhalation. Rationale: a spacer helps the patient coordinate inhalation with the release of medication, improving delivery to the lungs and reducing the amount of medication deposited in the mouth and throat. 30. What is the first-line treatment for managing chronic asthma symptoms? A. Short-acting beta agonists. B. Inhaled corticosteroids. C. Oral corticosteroids. D. Antihistamines. Answer: B. Inhaled corticosteroids. Rationale: inhaled corticosteroids are the first-line treatment for managing chronic asthma symptoms as they reduce airway inflammation and help control asthma over the long term. 31. Which of the following is a common symptom of exercise-induced asthma? A. Shortness of breath after exercise in cold, dry air. B. Persistent coughing that does not resolve with rest. C. Chest tightness with exertion and improved after exercise. D. Fever and chills after exercise. Answer: A. Shortness of breath after exercise in cold, dry air. Rationale: exercise-induced asthma typically causes shortness of breath, coughing, and chest tightness after physical exertion, particularly in cold, dry air. 32. What is the primary action of inhaled corticosteroids in the treatment of asthma? A. Relieve acute bronchoconstriction. B. Decrease inflammation in the airways. C. Promote airway constriction. D. Increase mucus production in the lungs. Answer: B. Decrease inflammation in the airways. Rationale: inhaled corticosteroids are used for long-term asthma control by reducing inflammation in the airways, which helps to prevent exacerbations. 33. A nurse is educating a patient on the use of a dry powder inhaler, DPI. What is an important teaching point for the patient? A. Inhale slowly and deeply. B. Shake the device before use. C. Exhale into the device before inhaling. D. Hold the breath for 5 seconds after inhaling. Answer: A. Inhale slowly and deeply. Rationale: when using a DPI, the patient should inhale slowly and deeply to ensure that the medication reaches the lungs effectively. 34. What is the primary reason for asthma patients to monitor peak flow readings? A. To track asthma medication side effects. B. To detect early signs of asthma exacerbation. C. To determine the effectiveness of exercise. D. To assess lung compliance. Answer: B. To detect early signs of asthma exacerbation. Rationale: monitoring peak flow readings helps patients detect early changes in airway function, allowing them to respond promptly to worsening asthma symptoms. 35. A patient with asthma is experiencing increased wheezing, shortness of breath, and difficulty speaking. What is the most appropriate action? A. Administer the prescribed quick relief inhaler and assess the patient's response. B. Ask the patient to take deep, slow breaths and relax. C. Order a chest X-ray to rule out other conditions. D. Encourage the patient to use a peak flow meter. Answer: A. Administer the prescribed quick relief inhaler and assess the patient's response. Rationale. The first step in managing acute asthma symptoms is to administer a quick relief medication like albuterol and assess the response. 36. What is the most common cause of asthma exacerbations in children? A. Exposure to cigarette smoke. B. Viral respiratory infections. C. Excessive physical activity. D. Use of corticosteroid medications. Answer. B. Viral respiratory infections. Rationale. Viral respiratory infections, such as the common cold, are a leading cause of asthma exacerbations in children. 37. Which of the following is a potential side effect of long-term systemic corticosteroid use in asthma patients? A. Decreased appetite and weight loss. B. Hyperglycemia and increased risk of infections. C. Weight loss and muscle wasting. D. Improved lung function and reduced asthma symptoms. Answer. B. Hyperglycemia and increased risk of infections. Rationale. Long-term use of systemic corticosteroids can lead to side effects like hyperglycemia, increased risk of infections, and osteoporosis. 38. What is the role of long-acting beta agonists, LABAs, in asthma management? A. To provide quick relief during an asthma attack. B. To prevent bronchoconstriction and control asthma symptoms over time. C. To increase inflammation and enhance mucus production. D. To treat infections that cause asthma exacerbations. Answer. B. To prevent bronchoconstriction and control asthma symptoms over time. Rationale. LABAs are used for long-term asthma control to prevent bronchoconstriction and improve asthma symptoms. They are not for acute relief. 39. A patient with asthma asks how to manage triggers at home. Which of the following should the nurse include in the teaching plan? A. Use an air purifier to reduce allergens in the home. B. Drink cold beverages to soothe the airways. C. Avoid physical activity, especially outdoors. D. Open windows to allow fresh air into the house. Answer. A. Use an air purifier to reduce allergens in the home. Rationale. Air purifiers can help reduce allergens like dust, mold, and pet dander, which can trigger asthma symptoms. 40. A nurse is educating a patient with asthma about inhaler use. Which of the following should be included in the teaching? A. Rinse the mouth after using the inhaler to prevent thrush. B. Hold the inhaler at a 45-degree angle when using it. C. Inhale deeply and quickly to get the full dose. D. Shake the inhaler less than 5 times before use. Answer. A. Rinse the mouth after using the inhaler to prevent thrush. Rationale. Rinsing the mouth after using inhaled corticosteroids helps prevent oral thrush, a common side effect of these medications. 41. What is the best indicator of asthma control in a patient? A. Frequency of short-acting beta agonist use. B. Frequency of using a peak flow meter. C. Regularity of visits to the healthcare provider. D. Patient's ability to exercise without asthma symptoms. Answer. D. Patient's ability to exercise without asthma symptoms. Rationale. The best indicator of asthma control is the patient's ability to exercise and engage in daily activities without experiencing asthma symptoms. 42. What is the mechanism of action of leukotriene modifiers in asthma management? A. Increase bronchoconstriction to prevent airway inflammation. B. Block leukotriene receptors to prevent inflammation and bronchoconstriction. C. Stimulate beta-2 receptors to relax bronchial smooth muscle. D. Inhibit the release of histamine during an allergic response. Answer. B. Block leukotriene receptors to prevent inflammation and bronchoconstriction. Rationale. Leukotriene modifiers block leukotrienes, chemicals involved in asthma inflammation and bronchoconstriction, helping to reduce asthma symptoms. 43. Which of the following medications is considered a controller medication for asthma? A. Albuterol. B. Montelukast. C. Epinephrine. D. Theophylline. Answer. B. Montelukast. Rationale. Montelukast is a leukotriene modifier and controller medication used for long-term asthma management. 44. A nurse is assessing a patient's asthma symptoms. Which of the following would be a sign of worsening asthma control? A. Using a short-acting beta agonist more than twice a week. B. Experiencing mild symptoms only during exercise. C. No use of quick-relief medication. D. Stable peak flow readings over the past month. Answer. A. Using a short-acting beta agonist more than twice a week. Rationale. Frequent use of short-acting beta agonists indicates poor asthma control and the need for reassessment of the treatment plan. 45. Which of the following is a common asthma trigger in the home environment? A. High humidity levels. B. Frequent exercise. C. Outdoor air pollution. D. Exposure to secondhand smoke. Answer. D. Exposure to secondhand smoke. Rationale. Secondhand smoke is a common asthma trigger that can worsen symptoms and increase the frequency of exacerbations. 46. A patient with asthma is using a peak flow meter and reports a reading of 85% of their personal best. What should the nurse recommend? A. Take a quick relief medication and monitor the symptoms. B. Increase the dose of maintenance medication immediately. C. Seek immediate medical care. D. No action is required. Continue regular activities. Answer. A. Take a quick relief medication and monitor the symptoms. Rationale. A peak flow reading of 85% suggests that the patient is experiencing mild symptoms. They should take a quick relief medication and monitor their symptoms. 47. What is the role of anticholinergic medications in asthma management? A. To increase airway mucus production. B. To relax bronchial smooth muscle and reduce mucus secretion. C. To promote bronchoconstriction. D. To reduce allergic reactions in the lungs. Answer. B. To relax bronchial smooth muscle and reduce mucus secretion. Rationale. Anticholinergic medications, such as ipratropium, help relax bronchial smooth muscle and reduce mucus production, aiding in asthma management. 48. Which of the following is a common risk factor for developing asthma? A. Older age. B. Exposure to secondhand smoke in childhood. C. Lack of physical activity. D. Previous respiratory infections. Answer. B. Exposure to secondhand smoke in childhood. Rationale. Exposure to secondhand smoke, particularly during childhood, is a well-known risk factor for the development of asthma. 49. What is the primary benefit of using a spacer with a metered dose inhaler, MDI? A. To reduce the number of inhalations required. B. To help improve the coordination of inhalation and medication release. C. To prevent the need for a quick relief inhaler. D. To increase the dose of the medication. Answer. B is to help improve the coordination of inhalation and medication release. Rationale. A spacer helps improve the coordination of inhalation with medication release, ensuring more medication reaches the lungs. 50. A nurse is preparing a patient for spirometry testing. What should the nurse instruct the patient to do prior to the test? A. Use their quick relief inhaler immediately before the test. B. Avoid eating a large meal before the test. C. Drink plenty of fluids to clear the airways. D. Avoid using inhalers for 24 hours before the test. Answer. B. Avoid eating a large meal before the test. Rationale. Avoiding a large meal ensures that the patient's diaphragm has enough room to move during spirometry, allowing accurate results. 51. Which of the following is a sign of a severe asthma exacerbation? A. Mild wheezing and coughing with no difficulty breathing. B. Ability to speak full sentences with no distress. C. Severe shortness of breath and inability to speak more than a few words. D. No coughing or wheezing after taking medication. Answer. C. Severe shortness of breath and inability to speak more than a few words. Rationale. Severe asthma exacerbations cause significant respiratory distress, leading to difficulty speaking in full sentences due to breathlessness. 52. Which test is most commonly used to assess the severity of asthma in a clinical setting? A. Chest X-ray. B. Arterial blood gas. C. Spirometry. D. Electrocardiogram ECG. Answer. C. Spirometry. Rationale. Spirometry is the most common test used to assess lung function and the severity of asthma by measuring airflow and volume. 53. What is the first-line medication used for quick relief of acute asthma symptoms? A. Inhaled corticosteroids. B. Long-acting beta agonists, LABAs. C. Short-acting beta agonists, SABAs. D. Leukotriene modifiers. Answer: C. Short-acting beta agonists, SABAs. Rationale: SABAs, such as albuterol, are the first-line treatment for rapid relief of acute asthma symptoms, including bronchoconstriction. 54. Which of the following is considered a controller medication for asthma? A. Albuterol. B. Prednisone. C. Fluticasone. D. Epinephrine. Answer: C. Fluticasone. Rationale: Fluticasone is an inhaled corticosteroid used as a controller medication to reduce airway inflammation in asthma. 55. Which of the following is a common asthma trigger in a patient's home environment? A. Dust mites. B. Physical exertion. C. Cold air. D. High pollen levels. Answer: A. Dust mites. Rationale: Dust mites are a common allergen and asthma trigger, especially in home environments. 56. Which of the following strategies is effective in managing asthma exacerbations at home? A. Limit medication use and allow symptoms to resolve on their own. B. Use a quick relief inhaler and monitor peak flow readings. C. Avoid using medications until symptoms worsen. D. Engage in strenuous physical activities to improve lung function. Answer: B. Use a quick relief inhaler and monitor peak flow readings. Rationale: Quick relief inhalers, along with monitoring peak flow readings, help manage asthma exacerbations at home and prevent worsening of symptoms. 57. What is the purpose of using a peak flow meter in asthma management? A. To determine the presence of infection in the lungs. B. To measure the airflow in the lungs and assess asthma control. C. To detect the need for long-term corticosteroid use. D. To assess heart function in asthma patients. Answer: B. To measure the airflow in the lungs and assess asthma control. Rationale: Peak flow meters are used to measure the maximum airflow from the lungs, helping assess asthma control and identify potential exacerbations. 58. What is the recommended treatment for an acute asthma attack? A. Administer a long-acting bronchodilator and monitor symptoms. B. Provide supplemental oxygen and oral corticosteroids. C. Administer a short-acting beta agonist and assess for improvement. D. Give oral antihistamines to relieve symptoms. Answer: C. Administer a short-acting beta agonist and assess for improvement. Rationale: Short-acting beta agonists are used for immediate relief of acute asthma symptoms by relaxing bronchial smooth muscle and improving airflow. 59. Which of the following is a potential side effect of inhaled corticosteroids in asthma patients? A. Hypertension. B. Oral thrush. C. Tachycardia. D. Weight loss. Answer: B. Oral thrush. Rationale: Inhaled corticosteroids can lead to oral thrush due to the medication's effects on the immune system in the mouth. Rinsing the mouth after use can help prevent this. 60. Which of the following is a common asthma trigger related to the environment? A. Physical exercise in hot weather. B. Exposure to allergens such as mold and pet dander. C. Increased exposure to cold, dry air. D. Lack of adequate sleep. Answer: B's. Exposure to allergens such as mold and pet dander. Rationale: Environmental allergens like mold, pet dander, and dust mites are common asthma triggers, especially indoors. 61. What is the purpose of using a spacer with an inhaler? A. To increase the dose of the medication delivered to the lungs. B. To help synchronize the release of the medication with inhalation. C. To help dissolve the medication before inhalation. D. To measure the amount of medication remaining in the inhaler. Answer: B. To help synchronize the release of the medication with inhalation. Rationale: A spacer helps ensure that the medication is inhaled properly by allowing the aerosol to slow down before reaching the lungs. 62. Which of the following best describes the pathophysiology of asthma? A. Obstruction of the airway due to smooth muscle contraction and inflammation. B. Infection of the airways by bacteria leading to inflammation. C. Inability of the lungs to exchange oxygen effectively. D. Weakness of the diaphragm leading to inadequate ventilation. Answer. A. Obstruction of the airway due to smooth muscle contraction and inflammation. Rationale. Asthma involves inflammation and bronchoconstriction, leading to obstruction of airflow and difficulty breathing. 63. What should a nurse do if a patient with asthma presents with a peak flow reading of 50% of their personal best? A. Administer a short-acting beta-agonist and seek medical help if no improvement occurs. B. Provide a corticosteroid and allow the patient to rest. C. Reassure the patient and monitor for further deterioration. D. Provide hydration and encourage deep breathing exercises. Answer. A. Administer a short-acting beta-agonist and seek medical help if no improvement occurs. Rationale. A peak flow reading of 50% indicates a moderate to severe asthma exacerbation, requiring the use of a short-acting beta-agonist and medical evaluation. 64. What is the most appropriate first step in treating a patient experiencing an asthma exacerbation? A. Administer a dose of oral corticosteroids. B. Apply oxygen therapy and assess the patient's respiratory status. C. Administer a short-acting beta-agonist via a metered-dose inhaler. D. Schedule a follow-up appointment with a pulmonologist. Answer. C. Administer a short-acting beta-agonist via a metered-dose inhaler. Rationale. A short-acting beta-agonist, like albuterol, is the first-line treatment to provide quick relief during an asthma exacerbation. 65. Which of the following medications is contraindicated in asthma due to its potential to cause bronchoconstriction? A. Beta blockers. B. Leukotriene modifiers. C. Short-acting beta-agonists. D. Anticholinergics. Answer. A. Beta blockers. Rationale. Beta blockers can exacerbate asthma symptoms by causing bronchoconstriction, and they should generally be avoided in patients with asthma. 66. What is a potential side effect of using a leukotriene modifier such as montelukast? A. Nausea and headache. B. Severe bronchospasm. C. Increased blood pressure. D. Oral thrush. Answer. A. Nausea and headache. Rationale. Leukotriene modifiers like montelukast can cause side effects such as headache, abdominal pain, and nausea in some individuals. 67. Which of the following is considered a long-term control medication for asthma? A. Albuterol. B. Prednisone. C. Budesonide. D. Epinephrine. Answer. C. Budesonide. Rationale. Budesonide is an inhaled corticosteroid used as a long-term control medication to reduce airway inflammation and prevent asthma exacerbations. 68. How should a nurse instruct a patient to use a metered-dose inhaler, MDI, with a spacer? A. Inhale rapidly and hold the breath for 10 seconds. B. Exhale fully before using the inhaler and then inhale slowly. C. Shake the inhaler before use and inhale quickly. D. Use the inhaler only after a nebulizer treatment. Answer. B. Exhale fully before using the inhaler and then inhale slowly. Rationale. Exhaling fully and inhaling slowly helps ensure proper delivery of the medication to the lungs when using an MDI with a spacer. 69. A nurse is caring for a patient with asthma who reports increased use of a quick relief inhaler. What is the nurse's most appropriate action? A. Recommend increasing the dose of inhaled corticosteroids. B. Advise the patient to rest and avoid exercise. C. Assess the patient's asthma control and review their management plan. D. Reassure the patient that this is a normal finding. Answer. C. Assess the patient's asthma control and review their management plan. Rationale. Increased use of quick relief inhalers indicates poor asthma control and warrants reassessment of the patient's treatment plan. 70. What is a primary goal of asthma treatment? A. Eliminate the need for medications. B. Achieve long-term control of symptoms and prevent exacerbations. C. Cure asthma completely. D. Limit physical activity to prevent symptoms. Answer. B. Achieve long-term control of symptoms and prevent exacerbations. Rationale. The goal of asthma treatment is to control symptoms long-term, reduce exacerbations, and improve the quality of life for the patient. 71. A patient with asthma is experiencing wheezing and chest tightness at night. What is the most likely cause of these symptoms? A. Asthma exacerbation triggered by exercise. B. Nocturnal asthma due to airway inflammation. C. Respiratory infection caused by a virus. D. Heart failure resulting in pulmonary edema. Answer. B. Nocturnal asthma due to airway inflammation. Rationale. Nocturnal asthma is common, as airway inflammation increases at night, often causing wheezing and chest tightness. 72. Which of the following is a hallmark feature of asthma exacerbations? A. Decreased mucus production. B. Bronchoconstriction and airway inflammation. C. Complete collapse of lung tissue. D. Hyperventilation leading to respiratory alkalosis. Answer. B. Bronchoconstriction and airway inflammation. Rationale. Asthma exacerbations are characterized by bronchoconstriction and inflammation, which narrow the airways and make breathing difficult. 73. A patient reports that their asthma symptoms worsen in the early morning. What is a possible cause? A. Hormonal changes that increase airway inflammation. B. Increased physical activity in the morning. C. Exposure to cold air during the night. D. Reduced use of asthma medication at night. Answer. A. Hormonal changes that increase airway inflammation. Rationale. Early morning asthma symptoms are often related to circadian changes, including increased airway inflammation due to hormonal fluctuations. 74. Which of the following can trigger asthma symptoms during physical activity? A. High humidity. B. Exposure to allergens. C. Cold, dry air. D. Eating spicy foods. Answer. C's cold, dry air. Rationale. Cold, dry air is a known trigger for exercise-induced asthma, as it can irritate the airways and lead to bronchoconstriction. 75. What is the primary goal of asthma management? A. To cure asthma and eliminate symptoms. B. To prevent airway inflammation and bronchoconstriction. C. To eliminate the need for all asthma medications. D. To increase the frequency of asthma exacerbations. Answer. B. To prevent airway inflammation and bronchoconstriction. Rationale. The goal of asthma management is to prevent inflammation and bronchoconstriction, reducing the frequency and severity of asthma symptoms. 76. Which of the following medications is a short-term relief medication for asthma? A. Fluticasone. B. Montelukast. C. Albuterol.
D. Theophylline.
Answer. C. Albuterol. Rationale. Albuterol is a short-acting beta-agonist, SABA, that provides quick relief by relaxing bronchial smooth muscle during an asthma attack. 77. Which of the following is a typical finding in a patient experiencing an asthma exacerbation? A. Severe hypoxia with low oxygen saturation. B. Wheezing and increased work of breathing. C. Noisy expiration without coughing. D. Absent breath sounds and apnea. Answer. B. Wheezing and increased work of breathing. Rationale. Wheezing and increased work of breathing are common signs of asthma exacerbations due to airway narrowing and inflammation. 78. What should a nurse recommend for a patient with asthma experiencing seasonal allergies? A. Continue normal asthma medications and avoid allergens. B. Discontinue asthma medications during allergy season. C. Avoid using a peak flow meter during allergy season. D. Increase the use of long-acting beta-agonists. Answer. A. Continue normal asthma medications and avoid allergens. Rationale. Patients with asthma should continue their prescribed medications during allergy season and avoid exposure to allergens to manage both conditions effectively. 79. Which of the following is a common cause of noncompliance with asthma medications? A. Excessive physical activity. B. Lack of understanding about the medication regimen. C. Overuse of quick relief inhalers. D. Frequent visits to the doctor. Answer. B. A lack of understanding about the medication regimen. Rationale. Noncompliance is often due to a lack of understanding about the importance of adherence to prescribed asthma medications, particularly controller medications. 80. What is a common complication of poorly controlled asthma? A. Chronic bronchitis. B. Recurrent pneumonia. C. Airway remodeling and irreversible lung damage. D. Pulmonary edema. Answer: C. Airway remodeling and irreversible lung damage. Rationale: chronic inflammation from poorly controlled asthma can lead to airway remodeling, which may result in long-term damage to the airways and decrease lung function.